Good afternoon, and welcome to the Cook County Health Podcast Series. Thank you for joining us today as we recognize Mental Health Awareness Month by discussing how to navigate anxiety. My name is Rocco DeMonico. I'm the Chief Psychologist in the Department of Psychiatry for the Cook County Healthcare System. I largely serve as an administrator for clinical psychology services and staff, and I also provide clinical care services for children and teens that are diagnosed with chronic medical conditions and may have accompanying emotional or behavioral issues that interfere with them reaching optimal medical outcomes. Often that involves working with children and teens with anxiety. Today, I'll be functioning as your moderator for this discussion. And before we begin, I'm going to share with you in the chat space some resources that are out there for folks struggling with how they cope with anxiety or manage anxiety and any other mental health crises. Living with anxiety can be very difficult, but there is help out there for you. With today's discussion, we are hoping to provide helpful steps for you to take in order to meet the demands of having anxiety and how to navigate through anxiety. But first, I'm going to turn to our panel members to introduce themselves, and I'm going to start with Dr. Miller.
Okay, good afternoon and thanks for joining. I am Dr. Joyce Miller. I'm the chairman for the Department of Psychiatry, doing mostly administrative work, but I still have the pleasure of providing clinical care at Providence Hospital. And I do want you to know that anxiety is one of the most common illnesses that we treat. So, as Dr. DeMonico mentioned, there is help. I'm going to turn it to Dr. Lee.
Please.
Hi, I'm Dr. David Lee. I'm a clinical psychologist here in the Department of Psychiatry. I've been here for almost 3 years now. I primarily provide outpatient psychotherapy services to adults. I practice at 3 different clinics throughout the county. So Providence Hospital, Austin, and our Robbins Health Center. That's one of the reasons why I'm here, right? Is I love working with such diverse populations, many who experience anxiety, and just how spread out our clinics are to reach different communities in Cook County. So welcome everyone.
Thank you.
Hi, I'm Sadie Waite. I am a psychiatric social worker here at Cook County. Primarily, I work in the emergency department doing psychiatric assessments for people in mental health crisis, but I also see adults with mental health disorders for behavioral health therapy 1 day a week at the Austin Clinic, and that's what I do.
Okay, thank you. Thanks. And I want our listeners also to take note that these 3 individuals represent the 3 primary fields of psychiatric care, mental health care, and hopefully we'll hear from each of them with their own unique perspectives based upon the fields from which they are coming. Okay, so let's go ahead and we're going to start with question 1 on what is anxiety and when in particular does anxiety become a mental health problem?
But I'm going to start with that question because I do want people to know that actually anxiety is a normal body's response. And so you want to have some amount of anxiety. Say you're studying for a test. You don't want to just be lackadaisical about it. You want to have some anxiety to push yourself to study for that test. But when anxiety becomes more of you having these more obsessive thoughts and worrying constantly, sometimes even avoiding situations, that's when it becomes a problem. I know some of my colleagues will certainly add to that.
Yeah, I like to tell a lot of my patients, right, anxiety is when it becomes more so something where, or at least the disorder, right, is when it starts impacting your functioning, right, whether that might be work, school, relationships. A lot of what you were talking about, Dr. Miller, is, anxiety is not bad, right, it's adaptive, right, so like you said, it gets us motivated, it gets things done, right, and so we don't want, the goal is never really to completely rid ourselves of anxiety. If you're walking down, a dark alley and someone's following you, I'm hoping that you're not running towards it, right?
Yes.
It's also sort of forewarning you that there might be some sort of pending danger, right? And for me, I think of, just in terms of some of the symptoms of anxiety, right? The cognitive pieces, the worrying, the rumination, attentional difficulties, and, being pessimistic or overly pessimistic, and there's impending danger. Some of the physical manifestations might be your heart starts racing, sweating, trembling, agitation, irritability, changes in how you eat, increases in substance use, trouble with sleep, right? Um, the sort of that mind and body connection, right?
Okay.
So I like to kind of remind people that anxiety, even when it's normal, is generally uncomfortable. It becomes a problem when it's causing interruption to your kind of daily living, stopping you from doing things that you want to do. And, it can be accompanied by other problems such as depression and sadness. And when those things happen, that's when you want to kind of try to seek additional support for it. But anxiety in and of itself is very normal.
Yeah, I was doing a little bit of research on sort of the frequency, right? And I think the World Health Organization mentioned 4 to 6% of people throughout the world experience anxiety, and I think around 31% of people have anxiety disorder at some point, right? And like Sadie was saying, right, there's a lot of comorbidity with depression, mood disorders, attention deficit disorder, substance use disorders, and I think only 1 in 4 people typically get treatment of some sort, and even less in the communities that we work with, right? Because of whether it be stigma or access to care, or access to culturally competent providers, or just generally knowing like what's available to them in the community.
And it's something, I'm glad you brought up the issue of stigma, Dr. Lee, because we still know that here, still in 2024, although there's been a lot of growth in education, particularly in the media, regarding psychiatric illnesses or anxiety and depression, we know that stigma is still there. And sometimes a person can say, what is wrong with me? Why can't I do this like other people? That's what I hear a lot in my clinic. And they're embarrassed about it. They're really sad about it and really upset about it. So I think, again, this is a good topic to talk about, to let people know there is help.
I think also that the way that the three of you have described anxiety in the terms of its kind of a dualistic quality, it's normal in some circumstances, and when it reaches the abnormal level is when it really becomes an issue that needs to be that should be addressed with professional resources. Oftentimes we malign anxiety as something bad, and that is not always the case, especially as Dr. Lee had mentioned. Okay, let's go ahead then and move on to our second question. What are the effects of anxiety on your body? I think, Dr. Lee, you started talking about that already.
Yeah, I talked about a lot of the physical symptoms. We know when, someone is overly stressed, right? Certain stress hormones can increase, such as cortisol levels, right? Which might impact your sleep. Weight gain, weight loss, right? Some individuals more so might experience physiological symptoms, right? Just in terms of the sweating, the trembling, the heart racing, nausea, right? A lot of my patients come in, they say, my stomach's been hurting for so long, but I've seen the GI doctor, I've seen primary care, which I think is wonderful, right? But we want to rule out also anxiety, right? So many times it will start impacting sleep and appetite and physiological sort of systems in your body.
I know I've certainly seen a number of patients that have gone to the emergency room. They're at home. They're thinking that they may be having a heart attack, where they get short of breath, chest tightness, breaking out into a sweat. and they get to the emergency room. And of course, the emergency room does this full workup. And then to just come back and say, well, there's nothing really physically wrong with you. And I think that, patients, in a sense, they may have some relief, but also some devastation of, why did I go through all of this and you can't find anything? And I think that's very disturbing for patients to understand it. But at the same time, we know that, it's still a better scenario than having a heart attack. And so I think that the physical symptoms are frightening when they're happening, because there is a sense for people who have panic attacks, we'll say, who have this sense of doom, like something bad is about to happen to me. But on the other hand, we have patients who just have this general anxiety every day, all day, muscles tense, can't relax. And they talk about that. And the worrying and the obsessiveness thinking about what's going to happen next, what's going to happen next. So the physical symptoms can be very, very difficult. And I know that patients are sure that something is really wrong with me physically, and something is wrong. And we need to make sure that we recognize that and validate that. But there's different treatment for anxiety than some of the other illness that you think you might have.
I think sometimes just
Another
having,
thing I see patients coming up a lot with is inability to sleep, which also, of course, will have health effects down the road. So that's another thing that really can happen in anxiety patients.
Yeah, I think sometimes just being able to help your patients, like anyone, like name it, is sort of the first step, right? And having a better understanding of, what's going on, right? Because for us as professionals, many times we think about it from a biopsychosocial model, right? So what is biology or genetics, right? And you can't sort of run away from that, right? And then the psychological causes and how we think about things, and the social environmental cues as well, or causes, right? And many times I have individuals who come in and they hear a loud noise and they're startled and they start feeling anxious and they don't understand, right? This might be a symptom of, a past experience or a trauma of some sort, right? Or what they've seen on the news, or, understanding it and being able to name it and describe like what might be going on, right? Goes a long way.
Yeah, I think it really does. And Sadie, I'm glad you brought up about sleep. I see a number of patients in my clinic who has a huge complaint about sleep, but I also know, talking with the PCPs, the primary care providers, that they have a number of patients that present with just insomnia. And many times that is an indication of anxiety itself. And so we certainly, again, want to add that to some of the disturbances that might occur that present, and you're not sure that it's anxiety, and you can talk to someone, as Dr. Lee mentioned, and just try to name it. Okay, this is really what it is. I'm feeling the sleep deprivation, but it's really anxiety that I need to deal with.
So I also want to follow up on a comment you made, Dr. Miller, about learning that in the emergency room that this is not a heart attack, and instead it's a psychological, psychiatric concern. I think oftentimes what I find in the patients who come in to see me after the ER visit is a sense of embarrassment or anger at feeling as if they've learned it's all in their head. So part of my job during the initial intake is really to kind of put this in a perspective of them understanding that, yes, it could be construed as being psychological, but that does not it doesn't connote what individuals think of when they hear it's in your head, right? Because it's a real thing. So.
Yeah, it's definitely a real thing. I've done community psychiatry most of my career and have worked in various emergency rooms throughout Chicago. And one of the things that I've tried to do is further educate even our ED doctors when patients come in like this, and to, at least try to discuss it a little bit more and help them understand that it could be anxiety, it could be this, it could be that, and they began to give them some of the words that they may try to understand,
Right.
to reassure them, but also just to educate them about this. But yeah, doctor, it's so true about feeling the embarrassment.
Yeah.
And that's what you don't want them to do because you want them to seek help about it. So yeah.
Mhm.
Okay. I'm going to stop for a moment and just express our thanks to everyone for making yourselves available for this talk today. This is a live Facebook discussion, so if you have any questions, don't hesitate to put them into the chat box below. Okay. So let's go head on to question 3, which is, while we know that everyone's experience of anxiety is different, and it's hard to know exactly what causes anxiety problems, can you please describe some of the things that can make anxiety problems more likely to happen, increasing the risk? Who wants to take this one first?
Well, I can certainly take it before my colleague. You know, there are so many things that could bring on anxiety. Uh, it could be as simple as the loss of a job, and the stress that comes with that, and the concern and the worry. Okay, it could be the loss of a loved one, where a person becomes more anxious and nervous. We definitely know trauma brings on anxiety, and we have to recognize that. And we're seeing that more and more often in our communities, where different things are happening, violent acts are happening, assaults are happening, and things of that nature. And all of that brings on anxiety as well. Even housing issues. Do you know when you're concerned and worried about your housing and where you will live and food insecurity, all those types of things can bring on anxiety. And for some, it could worsen into more of a problematic type anxiety. That's where I would start.
Yeah, I think, significant sort of changes in your day-to-day can sort of cause some anxiety, and anxiety is a reaction to stress sometimes, right? Overly feeling stressed, and stress isn't necessarily a bad thing, right? But a lot of stress, or significant changes can sort of bring on a lot of anxiety. Other things to sort of keep in mind, right, is substance use, right? So when someone comes in, they're thinking, is it alcohol, marijuana, any other illicit drug use, right? But also, I like to assess like caffeine use, right? I have individuals come in and, I'm at work and I want to sort of stay up, and so I drink, a ton of coffee or Red Bull or any other, caffeinated drinks, right? That sometimes causes people to feel like very anxious, right? Those things also come to mind for me. Or sometimes it's, if, like I said, right, it sort of runs in families. And so if mom, dad, siblings are, anxious people, then there's, higher probability that you might also experience some anxiety as well.
Mhm. Mhm.
Just to kind of piggyback too, sometimes the anticipation of a big change, having to move, even if that change is positive, getting married, things like that can bring on anxiety. Certainly a history of trauma in the past can make you more prone to have anxious periods. Anxiety doesn't always last forever. Sometimes you have periods where you have a lot of problems with anxiety, and then it gets better, and then it comes back, and that's just kind of the nature of it.
Mhm.
I also think the one thing that I believe was left out is the constant barrage of input on our websites, on the news, and how that impacts our perceptions of safety within the world. This is something that is fairly new within the last 10, 15, 20 years. And I think we're seeing an impact on many people's emotional states, especially in the area of anxiety related to this.
Mhm.
Yeah.
And I definitely want to touch on Say, for example, people have anxiety about making big speeches. Um, some of the college kids have anxiety, about doing that in their particular classroom when they know it's their turn to do the speech that day. And it's so many scenarios that can cause it. Meeting new people can bring on anxiety for some people as well. And so the point is that to just understand it better, and then we'll be talking about ways to help one with those types of concerns at some point here.
Yes, and also to dovetail that is oftentimes anxiety can be quite different one person to the next. You could have an individual who is very quiet and withdrawn, who you think is calm and relaxed, but their internal world is just reeling. And then you have on the other end of the spectrum somebody who is going through a full-blown panic attack. Right?
Mhm,
They're both anxious, but they look very different.
mhm.
And that's part of our job, is to try to help determine what is the diagnostic clarification, so it would guide our treatment modalities.
Mhm.
Okay. All right. Next question, panel. What are some ways one can cope with anxiety?
Well, I think it's different ways to cope with it. My concern is that when a number of people have this anxiety, they avoid the situation. And we as providers attempt to help a person to begin to do those things that may bring on anxiety, but think about it in a different way. And I really want to leave this to my other colleagues, because one thing I do want to impress today is that, we're in a world where we think that, taking medication is the thing to do. And when people need medication should be prescribed. But I cannot impress upon the effectiveness of therapy, particularly with anxiety. And, sometimes medication and therapy together is really the best option. Sometimes therapy alone is the best option. But whether you're on medication or not, therapy to me is one of the best treatments for anxiety. I certainly want to leave that to my colleagues on that note.
Yeah, I see a question that was been posed about, having anxiety in public and what to do, right? And my initial thought, right, is exposure therapy has been shown to be, really, really helpful, right? Like Dr. Miller said, it's almost like inoculation, right? We gradually expose someone to the fear, not too much, right? We sort of work our way up. We call it like social anxiety hierarchy, right? We want to make sure you master each step, right? We're not sort of just like throwing you in there with the wolves, right? And how this usually works, right, is like after a while with sort of thinking about things a little bit differently, learning some relaxation strategies such as like breathing exercises. If you're able to see yourself work through it, right, then you're more likely to be able to do it in the future, right? And a little bit earlier, I mentioned breathing, right? I know a lot of people say, oh, this is so silly. I breathe every day to live. Right?
Mm-hmm.
But learning how to breathe when, stressed or anxious or panicked, right, is one of the best tools, right? So I always tell people, take four breaths in, hold for 4. The longer exhale really helps activate what we call the vagus nerve that, triggers a relaxation signal to your brain. And I tell people, just like the gym, right, we practice that multiple times a day, not when you're completely anxious, right? You're sort of trying to build this skill over time, right? So those are, breathing is one way in which sort of we start, right? Helps with sort of grounding and helps with relaxation.
Mm-hmm. Mm-hmm. And as far as that question that you said this in the chat about in the public, and I think that, some of my patients have talked about this when they would get on the bus, the CTA bus, they begin to have a lot of anxiety. And the first thing they want to do is just jump off the bus. That's the first thing that they want to do. And I think, based on this question, what I'm imagining is, I think I would tell someone if they're having anxiety in public, the first thing I would want them to do is, try to find somewhere safe to sit. many times they feel like they're going to just pass out, I believe. And so I think that's one of it. But I think the breathing techniques, Dr. Lee, that you just talked about, I have found patients to tell me that has been so helpful. And yes, when they were going through it, they were like, why am I doing this? This doesn't make sense. This is not going to help me. But once they begin to enact it, they realize this can be helpful to me. I know, Sadie, you wanted to say something.
I was just going to piggyback off that. I hear a lot about the breathing techniques that it doesn't work. And I try to remind patients that it is a practice, and it's also trying to be aware of what are the first triggers of anxiety. So the first thing I kind of feel is kind of a stomach ache, and maybe start that breathing then early in your anxiety before it escalates to a point where you feel like I do have to escape this situation. And yeah, it is a practice. It doesn't always work right away, but the more you do it, the more it becomes helpful.
Mm-hmm.
There's sort of like a acceptance component as well, right? When you notice like your stomach hurting or you notice the anxiety coming on, right? I tell people like, just notice it initially, right? Because I think our natural sort of instinct is wanting to get rid of it, right? And the more you try to get rid of something, especially if you think about it even more, right? It sort of exacerbates it even more, makes it worse, right? And so, like you said, Sadie, sometimes like just noticing it, naming it, like allowing it just to be there for a little bit, writing it out can also be really helpful, right? Yeah, we sometimes sort of forget that some of these strategies that we already have in our wheelhouse, right? I tell people like utilize your 5 senses, right? It's available if you have all 5 senses, right? Like name 5 things you see, 4 things you hear, 3 things that you could feel, even if it's like sitting on the bus, your bottom's on the chair, your back's on the chair as well. 2 things you smell, 1 thing you could taste, right? It helps distract from that anxiety a little bit while not trying to completely escape from it.
Yeah, and realistic expectations of how this will unfold as we learn to cope with anxiety. I think that's very important, and it kind of fits in with the psychoeducation approach that we all practice in the work that we do with folks, trying to have a better understanding of where this is and how I'm going to regain control over my life. Okay, next question. What treatments are available at Cook County Health or John Stroger Hospital or Providence or the outlying satellite clinics? We have many sites where we provide psychiatric, psychological care.
Well, certainly, medication is available, medication management, and this is the role that a psychiatrist takes care of. And, what I'm happy to say is that in the past, we had a number of what I consider more addictive type medications that were being utilized for anxiety. And those types of medications play a role. But I'm glad to know that, since the last, 20 years or so, other medications have become available that has been very helpful for patients, that is not addictive, and that they can take ongoing to help with their anxiety. And one of the things that I want to note is that many patients, when they come in and maybe there's a diagnosis of it, the first thing they want to know is, how long do I need to be on this medication? And what I want to say to that is, it depends on the patient. I mean, some patients may stay on the medication, certainly go through therapy, which I recommend for all of my patients who have anxiety. And I want to make sure that the therapy is available. Some patients are able to utilize the techniques, and at some point in their life may be weaned off the medication, whereas some patients might need medication indefinitely. It's okay. And that's what I really try to talk to patients about. It's okay. We're going to work together as a team, and we'll both be figuring out when is the best time, if at any time, that medication could be weaned. Because the bottom line is that I want people to have a fulfilling life in whatever way that might be for them, and be able to do the things that they want to do and not avoid things. And so that's the role for the psychiatrist as far as medication management.
Yeah, there's a lot of therapies on top of medication that can be really beneficial as well. And therapy is not a one size fits all approach, right? And so that's the nice thing about the comprehensive team that we have here is we communicate with each other, we can make referrals to each other, and also to like all the specialists in the county as well, right? And so, but for me, cognitive behavioral therapy, otherwise CBT is what it's short for, focuses on sort of identifying and challenging, negative thought patterns and behaviors that are associated with anxiety. I talked a little bit about exposure therapy, acceptance and commitment therapy, or in short, we call it ACT, like learning ways to accept and challenge thoughts, right? Not to get rid of them, committing to behaviors that we call, our valued actions. I have colleagues who do biofeedback. It's a mind and body technique that you could use to help control some of your body functions, such as your heart rate, muscle response, breathing patterns. We have groups in the county as well that some of my colleagues run, such as a DBT skills group for individuals who experience intense emotions, and we learn strategies in those groups. And so there's a lot of different approaches, and again, it's not a one size fits all approach, but like Dr. Miller said, the goal is for you to function day to day and feel better, and especially just feel heard, right, and understood.
Just to kind of piggyback off that, I like to remind people that, therapy is also about the relationship between you and the therapist. And just because it doesn't work out with one therapist doesn't mean it won't work out with somebody else. So I like to remind people of that so that they don't give up on it. It's a process, and sometimes it takes a bit to find the right fit.
That's a great point, Sadie. And the other point I wanted to make to add to that is that I have a number of patients that they may have had therapy, a few years ago, and maybe it's time to go back into therapy. And that's okay, about whether it's related to some stressor on their job or something, or in a relationship that has brought on increase in anxiety at that time. And so people could go, if necessary, in and out of therapy. It's not just a one-time deal and then that's it. You don't need to do it anymore. But it's about fitting whatever the treatment that's needed at the time that's needed for that particular patient.
Okay.
I know that there's a question in here in this chat regarding anxiety in menopause. And I know that a lot of women are very concerned about some of the various emotions that they deal with when they're going through menopause. And certainly anxiety can certainly be one of them, as well as depression. We do see this type of population here at Cook County, along with such a variety of patients that we see here, which is one of the reasons that I enjoy working here and seeing providing clinical care, is because we see such a vast group. And so if a person is concerned about some of the anxiety that they're going through and they happen to be in menopause, I think that it would be appropriate to consider an evaluation. And an evaluation could even start with possibly a social worker or a psychologist. We know that at this point, at times it can be very challenging to obtain an appointment with a psychiatrist right now because of the demand and the supply. And so I want to make sure that people understand that we work here in an interdisciplinary type atmosphere. And we know that we have highly trained staff here, including the social workers as well as the psychologists, to perform these types of evaluations for people to get help. And then if there's an indication for medication, an easy referral to the psychiatrist.
All right. Any other comments, team, before we wind down? Okay. All right. Well, thank you to our panelists for their great answers. And while Mental Health Awareness Month is in May, at Cook County Health, we're here to address your mental health needs all year round. If you're struggling, you're not alone, and there are resources out there to help you. regardless of your ability to pay. And you may start by calling 312-864-0200 and make an appointment with us. I think I'd also like to hear some summary comments from our panelists. I would like to reiterate the sense of hope that we try to instill within the patients that we work with, that we have a great, talented, multidisciplinary team like Dr. Miller was mentioning, and we collaborate and work together to optimize the outcomes for our patients, whatever your goals may be. And goals are vastly different between patients, which also will inform types of treatment. So that's kind of my take, is that we are here to provide services, and we look forward to coming to our clinics in the future.
Well, one thing that I hope that I would like patients to remember, or people to remember from this, is that, as Dr. DeMonico talked about, there is hope. But more so than that, what I would like is for one to understand that sometimes it doesn't happen right away, and it takes time. And I would just ask for the person to just try to stick with the treatment that's recommended, and give it some time. That's all that I would ask. And I really believe that if this treatment is given time, it could be very helpful. I hate to think of someone feeling like this is what my life has to be like from now on, because I don't believe it has to. And so that's what I would like people to remember.
Thank you.
And I would love for this conversation to continue, right? And within not only the department, but also within your families or your support network, or even sometimes with strangers, right? You never know what people are experiencing day to day. And I think, the more we talk about it, the more it becomes, not stigmatized, right? And especially in various communities, right? And we're able to normalize it a bit and understand that there are treatments and people who can help with anxiety disorders.
Mm-hmm.
Sadie?
Yeah, I would just like to say, the health system is difficult to navigate, and sometimes it's hard to find a specialist. So if you're feeling like you're having trouble with anxiety and you need additional help, also please, go to your general doctor. Your family physician can provide referrals as well. I think people forget about that sometimes and kind of just try to jump straight to psychiatry. So just remember that's also a resource.
Mm-hmm.
Great. Well, thank you all. I do want to reiterate one more time to call 312-864-0200 should you like to get connected with a mental health psychiatry provider here within the county system. Okay, thank you for participating today. I look forward to seeing you in the future.